Our second finalist today is Emily White from the Department of Physical Therapy and Athletic Training. Her major professor is Dr. Hendrik Dirk de Heer. Emily's presentation title is Got Knee Pain?
Pain. Everyone's had it. In walking, almost everyone does it. But walking with knee pain, nobody wants that. Surprisingly, approximately 25% of the population not only walks with pain, but participates in activities like running and jumping despite being in pain. That's 1 out of every 4 people walking with pain. People typically report this pain in the front of their knee, as you can see, and when that pain lasts longer than 3 weeks, they are clinically diagnosed with patellofemoral pain syndrome, or PFPS. Having worked with several people who had PFPS, I decided to answer their million-dollar question: how do I walk without knee pain? Now, this has been a topic of research in the past, but nobody can really seem to figure it out and come up with a good treatment option for these people. My research focused on how to decrease knee pain among physically active individuals who reported an increase in pain with activities like walking, going up and down stairs, running, and jumping. As an aspiring physical therapist, I really wanted to focus on 2 things. 1, how exercise influenced pain, and 2, how therapeutic modalities influenced pain. There have been numerous studies focused on which exercises are most appropriate for reducing knee pain among people with PFPS. So my first question was essentially answered, and I used the existing literature to create an exercise program for my patients. Therapeutic modalities, on the other hand, had much less support. Ultrasound is one example of a therapeutic modality with limited support for reducing pain. Now, you might be thinking, isn't ultrasound what they used to take pictures with during pregnancy? And you're right, it is. But there's a second type. This second type uses a gel to introduce a healing current through the skin to injured tissues and potentially reduce pain. So, to see if this would work with my patients, I divided them into 2 groups. One who received exercise in addition to ultrasound, and another that received an exercise program alone. On the first day, patients in both groups reported a pain rating of 9 on a scale of 0 to 10, 0 being no pain at all, and 10 the worst they'd ever had. As you can see, a pain rating of 9 doesn't look too enjoyable. After 6 weeks of hard work and treatment, patients who received ultrasound in addition to an exercise program reported a decrease in pain from 9 to 1, whereas the other group didn't. And those faces over there are much happier. These patients reported a decrease in pain so significant that they were able to return to their normal activities like running and jumping again. So with this information, I would recommend that people who have pain with running and jumping talk to their physical therapist about incorporating ultrasound into their exercise program, because no one wants to walk with pain and no one should have to. Thank you.